Hello everyone, welcome to Careers 360 NEET PG interview series. Today we are going to talk about one of the most sought after branches after NEET PG counseling. Yes, I am talking about radiodiagnosis. To guide us through this journey, we have with us Dr. Priya Setia, who has completed MD Radiodiagnosis from AIIMS New Delhi. In this conversation, we'll discuss everything aspirants want to know. Why choose radiodiagnosis, its pros and cons, the impact of AI, career opportunity, private practice, and much more. So, if you are considering radiology after NEET PG, or if you are confused about whether this branch is right for you or not, this interview will give you all the clarity you need. So, let's get started. And I would like to welcome Dr. Priya. Thank you so much for joining with us today and giving us your valuable time. So I'll start with a few questions which we received from aspirants and a few generic queries which will help other aspirants to make an informed decision. So Dr. Priya, can you please introduce yourself and share about your journey from MBBS to getting MD radiodiagnosis at AIIMS? I'm sure आपकी जर्नी स्टूडेंट्स के लिए काफी इंस्पायरिंग होगी. So we would like to know about your journey.
First of all, I want to thank Career 360 for having me here and giving me this opportunity to be a part of this interview series. So my name is Dr. Priya Setia and I am very lucky to have been a part of two most prestigious medical colleges of our country. I did my MBBS from Maulana Azad Medical College, New Delhi, followed by my MD in radiodiagnosis from AIIMS New Delhi. After my MD, I have done 2 years post-MD senior residency from AIIMS New Delhi itself, and I'm currently employed as a consultant radiologist in a private diagnostic center in my hometown, Patiala. So the journey has been both of ups and downs. Again, sometimes we feel that we are not enough, we'll not be able to make it. But then again, we have our mentors, we have our consultants, we have our friends, our family, and always the career counselors available throughout the journey to guide us and help us choose the appropriate path, as well as the appropriate guidance and study materials that we received from DAMS, from Marrow, and some students also joined Prep Ladder, as well as the individual coaching classes. So that those all helped me get where I am today.
Why did you choose radiodiagnosis over other clinical branches which deal directly with patients?
So this is a bit complex topic. Actually, I personally feel that radiology is as much a clinical branch as the other ones. The only difference lies that in other clinical branches, we are dealing directly with the patient. We are examining the patients, we take their history, we record their signs, symptoms, and also order the biochemical workup. But in case of radiology, the diagnostic challenges and arriving at conclusion is just the same. The only difference lies in that we are examining the images and not the patient. But it is not that radiologist is just like a normal person who will just pick up the findings and give them in written to the clinicians. So we need to know the exact symptoms of the patient. We need to know the biochemical workup that is available. In the light of that, we make the diagnosis. So the challenge of clinical diagnosis remains the same, just like medicine. It is just that instead of examining the patient, we are examining the images. So coming to why I chose radiology. So this decision most of the students make during their internship time. First, we divide the branches into two segments, whether it is a surgical branch or a medical branch. So we know if you are a surgical person, surgery gives you thrill, or you are a medical person that you just want to be away from surgery site and you want to be a clinician dealing with patients directly or indirectly. So I always knew that I'm not a surgery person from my internship days. So that keeps general surgery, obs, gynae, and ortho is definitely not for, in my personal opinion, it is not that suited for girls. Coming to medical branches, we have again medicine, radiodiagnosis, psychiatry, and dermatology radiodiagnosis. From these branches, I thought whatever best I get according to my rank, I can consider that. I was not particularly interested in radiodiagnosis during my internship because we don't get that kind of exposure that is needed to know what difference actually the radiologists make. So, but again, based on the rank, then I decided that this is the best that I am getting. And I was not very interested to be examining the patients directly or about that clinical thrill. Medicine postings during internship felt very hectic. So again, for the work-life balance and considering my this personal opinion, I based on the rankings, I took radiodiagnosis.
We would like to know that every branch has its pros and cons. अकॉर्डिंग टू
Yes.
यू रेडियोलॉजी के बिगेस्ट एडवांटेजेस क्या हैं एंड व्हाट आर द बिगेस्ट challenges aspirants should be prepared for?
Coming to advantages, as I already stated, when you come to radio diagnosis compared to the other branches, it gives a flexibility of working hours. I'm not talking about residency. During residency, they may post you for 24-hour shift or even more than that. That just depends on the department, and you have to do whatever they ask you to do. But post residency, that is the 3 years of MD, it gives you a lot of flexibility. You can decide that you want to work only 4 hours, you want to work only 6 hours a day, you want your Sundays off, you want your guested holidays off, or you don't want to work night shifts, you don't want to take emergency calls. Coming in radio diagnosis compared to other clinical branches which have some or the other kind of emergency situations. And the second advantage that I personally feel, when you take some particular clinical branch like Opthel or ENT or any particular branch, that is, it is pivotal to all the clinical branches. So we have an overall knowledge of all the systems. Ops gynae people also come to us for opinion. ENT people also come to us for opinion. Medicine people also come. Inculcates the knowledge from all. Doesn't matter, and a lot of modalities to read about, to know about, and it is an ever expanding and evolving branch. So that is a very big advantage of this branch, with newer modalities, newer investigations coming up, and even interventional radiology coming up in a big way for coming days. So definitely radio diagnosis is one of a very upcoming and transformational branch. Coming to the challenges, yes, it is a challenging branch because some people interpret it as a chill or an easy branch. But personally, from my experience, I don't feel it is a chill or an easy branch because you may regularly are working. Each and every report requires the same amount of dedication. You can't just brush through the reports that I was very busy, I was very tired. Each and every person, each and every patient is a complete diagnostic dilemma, and you have to work. You can't miss a single finding. You have a patient with malignancy, small lesion, metastatic. It's a big responsibility this branch comes with, because retrospectively, if you are seeing post the patient was surgically operated and now you are seeing that there was a finding which was missed previously and it has spread and it should not have been operated basically. So that kind of responsibility, it is always at the back of our mind that we have to see the scans very carefully. Second thing that I feel is challenging about this branch is that the high cost of setup. So basically, if someone wants to have their own setup, it involves machines, and the machines, like if you talk about ultrasound, basic ultrasound machines for ops gynae scans, definitely in private centers people will go for ops scans. So it will cost around 30 to 40 lakhs. And for coming to CT and MRI, the cost runs in crores. And even the maintenance cost, like MR magnet needs to be on 24 hours. So it needs a 24 hours power backup. So basically the running cost is very high. So you cannot think of immediately after MD, you cannot think of starting your own setup like many clinicians do. They can open an OPD and they can start seeing the patients. You are very much dependent on jobs. So that is a disadvantage again. But yes, it has job opportunities and a lot of job opportunities with very good pay scales. So that kind of covers that up.
You have explained it really nicely. And so the next common doubt is radiology becoming saturated in India और टेक्नोलॉजी के इस एरा में आपको इसका फ्यूचर कैसा लगता है?
Okay, again, a very important aspect because AI is scaring a lot of people, and especially from taking radiology. Even I have been hearing about this since I took MD in radiology, that AI will come, radiologists will be out of job. Okay, so this I want to clarify that it is not like that. People think that AI will replace radiologists, but I personally feel until now what we have seen is that AI has only helped in radiology just like it has helped in other branches. It is not going to replace the radiologists, it's basically going to be a helping hand for radiologists. There is a quote by a famous Dr. Curtis that it is not that AI will replace the radiologists, but radiologists who use AI will replace radiologists who don't. So it is like about the demand of the time that you evolve with time. What current AI models are prepared for, those mostly deal with the high repetitive workload situations, like for screening programs, for triaging studies, or for reading chest x-rays. If say I'm in a government setup, there are almost 100 chest x-rays done in OPD, and putting them on a single radiologist is going to waste a lot of time. Similarly, about imaging, if there are hundreds of screening mammograms, most of them come out to be normal, and or some emergency situation where there are piles of cases. So I need to know which cases need to be seen by me first. So there comes the role of AI. So it can pinpoint that this is the case that needs urgent attention. This is the alarming finding, like a brain hemorrhage thing, which might be down my reading list. So it will help me in that way. Similarly, because of the advancements in softwares, we have newer machines. We have been able to do texture analysis, and we have been able to achieve even at the molecular level. Even initially, like brain tumors, we would only give them imaging that this is a mass, this looks like malignant lesion, it needs to be biopsied. But current brain tumor classification that even includes the molecular biomarkers which are seen even on imaging. So even without biopsy, we can predict that it might be this kind of tumor with this kind of mutation. That is like so much of advancement which we could not have thought before. So as I already told, as advancement happens, new imaging modalities enter. It is going to be game changing for the radiologists, and it is an ever evolving branch. It is nowhere to be replaced by AI. And as far as the question of saturation is concerned, currently there is definitely deficit of radiologists. So we have plenty of job opportunities even in government setup as well as in private setup, and we can choose if one wants to work under government or one wants to go in private sector. So we have multi-specialty hospitals. All the hospitals have a radiology department, and then we have standalone diagnostic centers also, which also rely only on radiologists. So they have working shifts. You can even work part time. You can even decide your modalities. You're comfortable in ultrasound, you're comfortable in CT or MRI. Accordingly, plus that helps you to improve your skills also. So there is a lot of job opportunity, and AI is nowhere to replace radiologists. It is just going to help, and it is an ever evolving branch. That's all I want to convey, that don't think that it is going anywhere. It is only going to expand in future.
आई थिंक विद दिस आंसर आपने बहुत सारे एस्पिरेंट्स की या बहुत सारे इंडिविजुअल्स की जो एक चिंता है और एक टेंशन है कि विद एआई कमिंग अप क्या फ्यूचर रहेगा रेडियो डायग्नोसिस का. नो डाउट दिस इज द ब्रांच विच इज द मोस्ट प्रेफर्ड अमंग ऑल द एस्पिरेंट्स, मेजरली अमंग ऑल द एस्पिरेंट्स. बट यस, एक कहीं ना कहीं क्वेश्चन था माइंड में या एक डाउट था कि विद एआई कमिंग अप क्या फ्यूचर हो सकता है और कोई प्रॉब्लम तो नहीं होगा इन द नियर बाय फ्यूचर और इन द कमिंग ईयर्स. तो विद योर आंसर आई थिंक सभी को इसका एक क्लैरिटी मिल जाएगा. अलॉन्ग विद दिस ब्रांच एआई इज गोइंग टू हेल्प देम. There's nothing to worry about if you are taking radiology as a branch. Right.
And one more thing I want to add here is that radio diagnosis is not entirely a diagnostic branch now, because interventional radiology has come up in a big way. Even there is now DM in interventional radiology. Fellowships were already existent, and apart from that, we do a lot of image guided procedures. So, anyways, those will be done by humans, and they are always going to be there. Rather than doing any procedure blindly, most of the clinicians prefer it to be done under image guidance, ultrasound guided, CT guided, even mammo guided breast biopsy. So basically, that's what I want to say. It is such a vast branch that you are never going to get bored. There are so many modalities, so much to learn, that it offers so much that you can get bored from any branch, but not from radio diagnosis.
So abhi with your explanation ye samajh aa gaya that branch is evergreen branch. Now we would like to know that not every branch suits every individual. So in your opinion, what kind of student or what kind of personality is best suited for radio diagnosis? किस टाइप के एस्पिरेंट्स को ये ब्रांच सीरियसली कंसिडर करनी चाहिए?
For this, personally, I feel there are people, even if they are in medicals, they want relaxed working hours. They don't want to do night shifts. They don't want to handle emergencies. So those kind of people are particularly suited for radio diagnosis, because you can regulate your work. And people may say that derma is also a chill branch, ophthalm is also a chill branch. But again, I told they are monotonous. But radio diagnosis, because of all the branches that are involved, the entire system that is involved, and so many modalities, it is not monotonous. So that is again an advantage of radio diagnosis, and there is lot to learn. So those students who are studious curious, they want to know more, they want to integrate anatomy, physiology, and the knowledge from medicine. And again, as I told, the branches are divided into two. So if you are a surgical person, you know that surgery gives you thrill, then radiodiagnosis is not for you. If you are someone who wants to deal directly with the patient, who wants to have answer to how much insulin should be given to a diabetic, or if you are a lone doctor in your family, your relatives are consulting you, and you want to have entire knowledge of medicines, their dose, then radio diagnosis is not for you. So according to me, if it is that you want a relaxed working environment, you don't want to get bored, you want to have a flexibility of working hours and with a good pay scale, and always interested in reading and learning, integrating the findings and knowing more and more, getting a little bit of exposure to patients in form of ultrasound and interventions, so definitely radio diagnosis is the best branch.
काउंसलिंग के टाइम पर यूजुअली एक बड़ा कंफ्यूजन होता है रेडियोलॉजी इन एन एवरेज कॉलेज वर्सेस another branch, say medicine, in a top institute like AIIMS or any other top institute. So, what would you advise aspirants in such a situation?
So here again, I want to say that it is not just about radio diagnosis. It is always branch over college. So if someone has interest in a particular field, in a particular branch, no matter what college you are getting, just go for that. Don't give up on your passion, because the college is there to stay with us for 3 years during MD. Post MD, the branch, its work, how you are dealing with your branch and the patients, that is going to stay throughout your life. So if you are sacrificing on your dream branch for a college which just ends after 3 years, the rest of the life you won't be able to feel satisfied working in something else. So I feel it is not just about any branch, it is like or any college situation, it is always branch over college. So whatever branch you want to take, go for it, then fill the college in the order of reputation or ranking list, and based on that, whatever you are getting best college you can take, but always first fill the branch which you want most, then second number the second preferred branch. So always in order of branch.
So as you mentioned कि branch को preference देना चाहिए and then they should decide the order while
Yes.
filling up the colleges. So according to you, like this is another important, I think, question for the aspirants. According to you, which are the best colleges in India for radiodiagnosis? And when students are choosing a college, what key factors should they consider? For example, like should they also look out for type of equipments, machineries available in any hospital? And if possible, could you name a few important machines or technologies that every good radiology department should ideally have?
So again, this is very important point. Yes, I did some work about finding out which are the other best colleges for radio diagnosis. So what I found is definitely central institutes are good, be it AIIMS, PGI, JIPMER or CMC Vellore. All of them have good radio diagnosis departments. Then further coming down, according to the ranking, it is always Delhi and Mumbai colleges which are at the top of the ranking list. That basically also includes just the equipment wise also, patient load wise also, and also a major factor of cities, that people want to stay in those cities, that makes them up higher up in the ranking list. So yes, coming to what are the factors that should be considered, the most important things that I personally feel is that you should look for the equipments. All the modalities should be available, because if your 3 years of MD is a big time, so even if one of the machines is missing, like there are many colleges which don't offer MRI, which don't have adequate load of MRI, and then there are colleges which do not have mammography equipment. So if you are not exposed at all to these things during those 3 years, it gives a huge disadvantage. After 3 years, you feel kind of a handicapped, that I'm not able to read this particular imaging. Anywhere you go, you will spend time, you will feel that this is what I lack. So I personally feel that modalities is the first thing, that wherever you take up, you should see that all the modalities are available. And coming to modalities, the basic modalities that must be there include a good load of ultrasound Doppler imaging, CT and MRI is must, followed by mammography and X-rays. Basically, these 5 things should always be there. MRI is must, because it is actually a complex imaging. If you're not exposed beforehand, after 3 years you will feel a lack. And coming to this, so UCMS in this matter in Delhi has a disadvantage, it does not have MRI machines. So it's always that you have to see ki, should you take it or should you not take it? So coming further, as we already talked about interventional radiology, that is also coming up in a big way. So there are colleges which have already full-fledged interventional radiology departments which are doing vascular, non-vascular interventions. So if you are exposed to those during these 3 years of MD, definitely it is an advantage to someone who has never done any interventions after their MD. So that again is an advantage. In AIIMS Delhi, we do almost all kinds of interventions except for the neuro interventions, which mostly comes under DM neuroradiodiagnosis. But apart from that, whole body interventions, both vascular and non-vascular, are being done in AIIMS Delhi also. So in that matter, even KEM Tata Memorial in Mumbai is good if you are interested in interventions. PGI also has interventions. So these are the colleges which are mostly suited for interventions. But non-vascular interventions, most of the colleges are doing ultrasound guided procedures, pigtails, PTBDs, PCNs. These things should be considered. Apart from that, caseload should be considered. What is the number of postgraduate seats? What is the average amount of cases that you'll be doing? Another factor that most people ignore, I feel is important, is the geography, that is the location. MD in any branch, not just in radio diagnosis, is very demanding. So you need to be close to your support system, your family. It should be at a reasonable distance with good connectivity. So whenever you get time, at least for a Sunday or a Saturday, you are able to go home. Else it puts a lot of stress on the person who is going through these things, that during 3 years I'm not even able to visit home. And it also affects the cultural thing. You're not getting the food of your choice if you are going like very far away and for this thing, and also leads to language problems. So I personally feel that you have to consider all these things, that you should know the local language, you should be used to that food habits, it should be close to your home so that you can visit your home, and then you can see the rankings definitely if all the modalities are available, that thing. And the third thing which people consider, which is not that big a deal, is the bond thing. So most of the places have 1 or 2 years of bond. I think MAMC has also recently introduced 1 year of bond. So again, I want to stress here that immediately after MD, no one is fit to go for independent working in a private center or even anywhere. So we need some post MD experience in the form of senior residency, 1 or 2 or 3 years, according to how confident you feel, because in that time we work under our seniors like our consultant, and we get the knowledge to take independent decisions in patient's care, which does not happen during MD, because in MD most of our time goes in academics, it goes for exam preparation, it goes for thesis writing. So the real practical knowledge we acquire is after MD. So if there is a bond and you are doing compulsory 1 year or 2 year of SRship in that same place, it is only going to add to your experience. So that is not a big drawback about the bond. So 1 or 2 years of bond does not create much problem. So that has to be considered. But if there is like 3 to 5 years of bond, then you might keep that on the bottom list, because no one wants to stay bonded for 3 to 5 years.
So, you have mentioned quite helpful factors which aspirants should consider. And as you mentioned about interventional radiology, so which are the other super specialities in radiology, and which are the most exciting or promising today?
That depends on personal interest also. After radio diagnosis, we have a lot of fellowship options as well as even DM options, super specialization options. In AIIMS, we have DM neuro radio diagnosis and DM cardio rad, so basically for brain and heart. And apart from these, there are DMs in interventional radio diagnosis and fellowships, fetal imaging, in women imaging, breast imaging, musculoskeletal imaging. So there are a lot of options. Tata Memorial, dedicated to the cancer patients, offers a lot of fellowships in onco imaging. So there are a lot of options that you have after MD.
With this, you have explained about MD. So, MD versus DNB in radiology. How should aspirants think about this choice? So, क्या according to you branch ज़्यादा important है, like radiology, or they should consider about the degree as well?
Initially, there was this notion that in DNB passing rates are very low. So that was the reason people didn't prefer DNB. And secondly, somewhere it was that MD is better than DNB kind of situation. But now that everyone knows that these are just myths, DNB is considered at par with MD. There is no difference. You also do thesis in DNB, not just in MD. So everywhere, anywhere you go for job, DNB is considered equivalent to MD. So coming to deciding the college, whether MD or DNB, I feel that if you are getting, say, you are getting radio diagnosis in a peripheral college that does not have enough equipment, that does not have MRI, you're not getting any exposure during those 3 days, versus you are getting DNB in a college that is equipped with all the latest equipment, you should go for DNB because that will offer a big advantage. When you come out after those 3 years, you will feel more confident. You have the exposure, good caseload, and definitely that will be an advantage rather than just a piece of paper that you have MD, not DNB.
The next thing would be regarding the financial aspect. As a financial aspect is always important. So radiology complete करने के बाद earning potential कैसा होता है? And what kind of job opportunities are available in India?
Post MD, as I already stated, most of the people prefer doing senior residency. So that time the pay scale is just like other branches. It is always same. It does not depend on the branch. If while you are doing residency, be it post graduation or senior residency, the pay scale is just the same for all the branches. So after senior residency, when you enter in the private setup, if you are planning on setting your own setup or own center, that involves a lot of cost input. As I already stated, the machines are very costly. So if so you need a background wealth, or you need to have that money to put to invest, or sometimes people go for ultrasound initially, and once they are able to gather that amount of money, they slowly expand and start CT and MRI as well. But initially, starting ultrasound, CT, MRI all together at your own center, it is not a feasible option. So coming to jobs, in the private setup, there is plenty of jobs. There is no saturation. You may not get it exactly like if I'm in a tier 2 city, I'm not able to, all the jobs are full. I may get it at 1 hour, 2 hour distance. Then I may go to a metro city. There are plenty of jobs in Delhi and NCR, lots of multi-specialty hospitals, so there is lot of job opportunity, and they offer a good pay scale, so anywhere between 3 to 6 lakhs being offered. That depends on the place as well as your experience, your expertise, how many caseload you are able to handle. Some places even pay on per case basis to the radiologist. Like if you are handling 10 cases per case, they will give you amount. That is the remuneration per case. So definitely the person who reports more will get more. So again, it is mostly dependent on place as well as how much you are efficient, how much you are able to handle. But definitely it gives better packages compared to other clinical branches.
Now, this is a, I believe, a personal opinion, but बहुत लोग ऐसा बोलते हैं कि रेडियोलॉजी एक टॉक्सिक ब्रांच है. सो आपके एक्सपीरियंस में ये कितना सही है और इसका वर्क लाइफ बैलेंस अदर ब्रांचेस के कंपैरिजन में कैसा रहता है?
Okay, so coming to the point of toxicity, so it again refers in many contexts. Like during MD, it may feel toxic because of the department. So that again depends on the college, the dynamics of that college, the faculty that you work under, your seniors. They may lead to department toxicity, but after surviving those 3 years, as I already told, it is a very flexible branch. There is no toxicity. After that, you can decide that I want to work 6 hours. I don't want to work 8 hours. I want to work 4 hours. I don't want to do night duties. I don't want to do emergency shifts. So after your MD, there is a lot of flexibility. During MD, toxicity depends on the department. I have been very lucky to be a part of a very friendly, very good department where our faculty were always so approachable, always ready to help us. They never let us feel down or never let us feel that you don't know this thing, you don't know anything. They were always very helpful. Throughout our MD, they were very helpful. So that depends on department to department. But mostly there will be some seniors who will be good. People can go to learn from them. Basically, toxicity is always about the department during MD years. After that, it is a very flexible branch with regard to working hours, with regard to the amount of work, even the modalities, everything is flexible.
What is your opinion about diploma in radiology? Is it worth it, or what can be the scope for aspirants opting for DMRD?
Diploma in radiodiagnosis is also good. Basically, it is 2 years course compared to MD, which is 3 years course. So diploma also gives adequate exposure. It is just that you don't do thesis, and that is again a little bit of a drawback, that instead of degree writing MD, you are writing diploma, and that will give you a disadvantage when you are applying for jobs. So definitely, hospital is considering two candidates. One of them is degree holder and one of them is diploma holder. Even if diploma holder has more knowledge, they will definitely take a degree holder. So there is that disadvantage. Otherwise, diploma also same colleges are offering, and exposure during diploma 2 years is enough if you're not doing thesis. but it is always better that if someone has done 2 years diploma, then after diploma they can again go for MD and or DNB, and that will be just 2 years. So instead of 3 years for MD, they will just have to do 2 years, and then they can write as MD. So it basically completes a 4 years course.
So, this would be my last question. So, if you had to give your top three pieces of advice to NEET PG aspirants who are considering radiodiagnosis, so what would those be?
So the first and foremost that I want to bust this myth that don't get afraid of AI. AI is there to help. It is not going to replace a radiologist nowhere in near future. So just don't be afraid that AI will come up, then radiologists will be out of job. So I should not do radiology. So just keep that apart. AI is not going to harm you in any way. It is an ever expanding branch. Second thing that I want to say is that it gives a lot of opportunity. It is an ever expanding branch, a lot of modalities, lot of new tests coming up. Even for the previous diseases, new workups are being done, new methods are being found to diagnose this disease, and the role of imaging is expanding. So the branch is ever expanding and evolving. But if you are a person who gets thrilled only by taking histories, clinically seeing the patients, examining them, then radio diagnosis is not suitable for you. And lastly, again, I want to emphasize always prefer branch over college. So, no matter you are getting a very good college, but you are sacrificing your dream branch, you won't be happy after those 3 years when you have to work about it for the rest of your life. So, first decide which branch you want to pursue and then go for that particular branch in order of the preferred colleges.
Thank you so much, Dr. Priya, for sharing about your journey and for such valuable insights. I am really sure कि आज के इंटरव्यू से नीट पीजी एस्पिरेंट्स को रेडियोलॉजी ब्रांच के बारे में एक क्लियर पिक्चर मिलेगी. And as you mentioned that aspirants should not worry about AI replacing the doctors. There is a lot of flexibility and numerous opportunities. The doctors who do not want to get bored or they can take up radio diagnosis. You have clearly mentioned किन aspirants के लिए ये branch suitable नहीं होगी and क्या factors हैं जो consider करने चाहिए जब branch को select करना है, किसके लिए ये branch ज़्यादा suitable है, and I'm sure that it will definitely help other aspirants in decision making and will give clarity about the branch. So thank you so much for taking out your valuable time and for joining us today for this interview. We are really thankful to you for such valuable information which you have shared with us today. Thank you so much.
It's my pleasure to be able to help.